Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo in the Fug House of a Sunday, discussing once again fluoride.
Yeah, I think, there's interesting things that keep being discussed about it. And you sent me an article that I found pretty fascinating.
Yeah, I guess fluoride's just in my algorithm now. I'm going to start getting articles about it all over the place.
Well, pass stuff along.
Okay.
And I'll pass stuff along too. But this article came from Science News, and it's titled, "Two Cities Stopped Adding Fluoride to Water. Science Reveals What Happened," authored by Alex Vivieros.
I had no idea that cities of this size had taken fluoride out. I thought it was just, backwoods little in the hollers like we are that would do things like that.
Yeah, the tiny little coastal towns of California that are mysteriously getting help to do that.
Right, and becoming cavity clusters. But yeah. So, Calgary and then Juneau. That's nuts.
Yeah, Juneau. But specifically, they're looking first at two Canadian cities. So Calgary, and I don't think Juneau's Canadian yet. Calgary stopped fluoridating water in 2011, and they compared it with Edmonton, where water continues to be fluoridated.
Right. So there you go.
And I think the study, although they weren't super clear about it, was done around 2018, 2019. Because they were talking about kids going to school, so I think it was pre-2020.
Sure.
And they were talking specifically, they looked at 7-year-olds to be evaluated in schools by dental hygienists. Mm-hmm. Isn't that like a dream resource? If we could have more than 5 dental hygienists, and then they could go into the school. So they picked the age group specifically because they figured they hadn't been exposed to fluoridated water in Calgary because it was post-fluoridation.
And you have your adult teeth by then, too.
Yeah, that's part of it. But they're not accounting for kids that, maybe live somewhere else or parents were supplementing with fluoride or stuff like that. But anyway, out of the 2,649 Calgary kids, 65% had tooth decay.
Well,
First of all, I'm shocked by the number.
Really? Why? What do you think it should be? Because I'm shocked by the 55% in Edmonton where there was fluoride. I mean, that's a 10% swing, but I'm still shocked that there were 55% of the kids had tooth decay.
Right. So I think there's more factors that go into it, like genetics and probably socioeconomic access to dental care.
Maple syrup.
Yeah, and do parents make their kids brush? Do they make them brush correctly?
Right.
There's a lot of complex factors.
I think just across the board, we're not brushing right. Do you get that?
That's right. Yeah, the dental hygienist told me last time I was in that that regular manual toothbrushes shouldn't be a thing.
Really?
That it should all be electric toothbrushes.
Wow.
Yeah.
So it doesn't matter, because it always keeps going up. It was like, I remember it being something, and then it was like 90 seconds, and then it was like, now it's 2 minutes, I hear.
That's
but really,
2 minutes.
just manual, just forget it.
And your kid has to be coordinated enough to tie their shoes. So there's not only a time limit, there's an age skill level, anticipatory.
Wow.
So what they do at UHS Dental is, if you get to be in a drawing if you have no cavities, and then you get a special electric toothbrush. And I'm like, if I win it, can I give it to maybe the person who didn't make the drawing who really needs it?
Right. That seems kind of wrong-headed.
A little backwards.
You should win candy. And then
yeah, that's right. And more candy. Anyway. So 55% of the Edmonton kids did have what we call sugar bugs in my clinic. And so,
like the beginning of tooth decay? That's sort of.
Mm-hmm. But the level of tooth decay in Calgary that required anesthesia, which is more serious tooth decay.
Yeah.
And not without risk itself. Anesthesia is the thing, And in this town, if you have a kid that requires dental care with anesthesia, that means you're going either to Eureka, maybe Santa Rosa, and a lot of people go to Redding for some reason.
Wow.
Yeah. And so the most severe tooth decay that required anesthesia in Calgary was 32 out of 10,000, and only 17 out of 10,000
Yeah,
in
see,
Edmonton.
there's
That's
a
the
qualitative there's a qualitative difference right
Right.
there. Yeah, yeah.
Well, the other statistic met criteria, just test doesn't look. We didn't apply a p-value or anything.
Yeah, man,
Yeah,
that's my
so-
story of my life.
So kids have tooth decay. When kids have no fluoride access, they have tooth decay, and they have more serious tooth decay.
Right.
That not only is jeopardizing their global health, but is a pretty great burden on parents to get the kids to the right care. And it's not as simple as what a lot of anti-fluoride people tell me is that, well, if their dentists would just take care of the kids. That's not the solution.
Seriously? Wow.
Seriously. If there were just more dentists that accepted Medi-Cal, which is, Medicaid on a federal level, if you're...
Typically, I find the people who argue against fluoride are also arguing against government aid for things like, medical things.
However,
and
they're
healthcare.
paying for stuff with their taxes. So they're paying for
emergency care. and
more
all of- yeah.
emergency care, more advanced care, more complicated care. So it's like a hidden tax.
Right,
And
right.
I don't know why they don't see that. I also don't know why they're not more upfront about what the state of their dental care is.
How do you mean?
Like, I'm wondering if some of the anti-fluoride people in this community, like, what's their dental health?
Sit down and smile for us.
Yeah,
Let's
if you've
see,
got
right?
it figured out how to do it, let's see the proof.
Wow.
So this study convinced Calgary to bring back fluoridated water in 2021.
I wonder what sort of like political mayhem ensued, or was it like a civilized kind of thing?
Well, what happened was they kind of implied in the study that when the fluoride was taken out of the water, that was taken out by very few, small number of not very educated people who were putting forth like opinion disguised as non-data.
That sounds familiar.
Yeah.
But they were able in the public forum to combat that the second time?
Yes, the second time, the more educated, I would say knowledgeable people were able to bring forth actual data to support their position. And then they also kind of activated the community to advocate for it.
Wow.
Which could happen here, folks.
That would be
Just saying.
something to figure out what that game plan looks like,
Yeah.
Wow. All right.
Yeah.
So what's happening in Juneau, Alaska?
So Juneau, Alaska stopped fluoridation in 2007. And what they did in their study was they pulled data from Medicaid claims, which is what we call Medi-Cal or partnership. I don't know what they call it in Alaska. And they looked specifically at kids under 6 who needed procedures to address their problems.
Okay.
And that's not necessarily just anesthesia. That could be filling a cavity, like a temporary filling even. So anybody that needed a procedure. And so what they found was when they pulled their fluoride, those kind of required procedures went from 1.5% of kids under 6 to 2.5%. That's a pretty big increase in number.
Well, it's a big
Overall.
Is it? I don't know.
Yeah, it is.
What are we looking at here? How many kids?
Hard to say.
Right.
But we're looking at percent. But Juneau's not a small town. It's not like it was 5.
True.
So,
Yeah. This is what gets me is the average cost of the procedure, though. That's
Yeah. And the procedure and the average cost, I think they used as maybe a marker of severity, but the average cost of the procedure increased $303.
Wow.
So they needed more care overall. They needed more expensive care. And they didn't even address anesthesia, which is a whole different ballgame. So the Medicaid payments come from taxes, federal taxes. So this could be considered a hidden tax. But what they didn't really consider is that good oral health is connected to good general health. And what if you followed these kids longitudinally until they were, I don't know, all dead, the whole cohort
Right.
aged out? And it'd be interesting to see what kind of health problems they get and if those health problems are relevant to their dental state.
How in depth is our understanding of that connection between oral health and overall health?
It's pretty good.
Is it?
Heart disease is a big deal. We talked about sleep apnea before and how that was important to get diagnosed to keep from having further, development of heart problems. Dental stuff, it also goes to the heart too.
Wow.
And I couldn't really address it without some research into more specifically, but there is a lot of heart disease up here. I don't know if that means there's a connection.
Right.
So hard to say. And I don't know if you break it out during the time that Crescent City had fluoridation versus the time they don't have fluoridation.
Yeah, but do we understand how that works? How good dental health affects things like heart health? That just seems like such a jump, and I'm wondering
I think
what the
if I had to
mechanisms are.
guess, wild guess, data-free zone, it's probably valvular heart disease. And if you have problems with the valves in the heart, then you start to have pump failure. So it goes into congestive heart failure, which has an average time to mortality from time of diagnosis of 5 years. So it's a pretty cruel disease, and we have a lot of it up here.
So what's that got to do with your teeth?
I don't know without further, this is just my educated guess.
Okay.
I don't have any further data on it. Be glad to look it up.
No, I'm just curious. I mean, that was I was asking.
I think because there's bacteremia. So you have infection, you have lousy gums. So that barrier to bacteria getting into the bloodstream is like,
Okay.
And so I think you have times where you might be transiently bacteremic. So that means for a temporary period of time have bacteria in your bloodstream. And if that happens, the bacteria preferentially settles out in heart valves for some reason.
Wow. Okay.
So that's why they give people with heart valve disease prophylactic antibiotics before they do dental procedures.
Okay.
So my guess is it has something to do with that, but it could also be multifactorial.
Gotcha. Okay. Thank you.
That's my guess. So it's worth saying again. So we talked about this the last time, where the National Toxicology Program, which is part of the Health and Human Services in the U.S., published a study that seemed to associate lower IQ levels in children with fluoride in water above 1.5 milligrams per liter. And it said specifically, so I got the study emailed to me, probably every healthcare provider did. This was back on the end of the Biden administration when we were still getting information like this. And I read the introductory, paragraph and all that. And in bold-face type of this multi-hundred-page document, it said, do not draw conclusions about fluoridated water with the study for two reasons. One is it's not cause and effect. The data weren't good enough to assume cause and effect.
Okay.
So it's just kind of a causal correlation. And the second thing they said is that was at the measurement of fluoridated water that's much higher. So they drew a lot of their data from Africa.
Okay.
So what we would call over-fluoridated, grossly over-fluoridated water. And what happened? Well, Utah was off and running with it, and so they cited that study as a reason to take fluoride out of the water statewide. So I don't know how you can... Science is science, okay? And in my opinion, it's as close to black and white as we get. And how can you see that in bold-face print in the first paragraph and just blow it off?
Right.
Except if you want to be in a science-free zone and tell everybody what your personal opinion is and make everybody live like you. And I think that's grossly unfair. So, no meaningful connection. And the what they saw was maybe really, really highly fluoridated water could cause that. They don't know that. They didn't look at any other factors. So garbage in, garbage out.
Do you know why the water in Africa could be highly fluoridated?
I think that it's possible that, there's natural sources of fluoridation they're not taking into account.
Okay.
And then I think it's also possible that they've got some bugs in their system if they are actually fluoridating their water, and maybe they lack the resources to monitor it closely.
Right.
This is all
Yeah,
a
just a
guess.
surmising. Sure. Okay.
Yeah, I mean, the whole way we knew fluoride was helpful in preventing dental decay was somebody happened to notice that people getting water out of the certain well had great teeth
Wow,
compared
okay.
to everybody else that, they were losing their teeth in their 20s.
Yeah.
And this was kind of pre-industrial revolution, so sugar was not as big a deal in that observation. So what the individual figured out was that there was fluoride in that well, so naturally occurring fluoride.
Okay.
So that's how we got onto this in the beginning. So Calgary brought back fluoridation of the water, and I'm wondering if Crescent City could too. And so I would like to occasionally revisit this fluoride debate, and my commitment is for data-driven. So, expect to hear more about it in the future. I'm hoping that there can be some people that maybe in the medical community or the dental community have the energy to revisit this on a citywide level.
Exactly, on a local level like that. It'd be nice to get some numbers if we had those numbers anywhere, that, just about.
Yeah, we talked about maybe going to the public health department, and that's also on my list of stuff to do. But I'll tell you, since COVID, healthcare providers are kind of burnt out and very tired of being like a kill the messenger situation where we bring something that we know to be true, that we have data that support, and we get shot down by less educated voices. It's really depressing.
While you were talking, I got this idea, just about why science is such an uphill struggle for a lot of people, understanding the conclusions. And scientists, it seems, come at you with two basic messages about science. And one is that, look at this, it's data-driven, here it is, this is black and white, hard and fast. And then also it's a theory that changes over time.
Okay, but theories don't change over time. So that's a misuse of how the word theory is used in science.
Okay.
Theory is nailed
then.
down.
Gotcha. Okay.
Yeah.
See, so that's not exactly the colloquial use of the term theory either. Theory is something could go either way.
Right.
So again, that's another disconnect. I don't think we're.
It also sounds like I'm smarter than you, so I'm going to tell you the way it is. And
Right,
I know
people
that
don't.
annoys all my friends when I go, well, actually, the data show, and then they'll roll their eyes.
Yeah, right. Exactly. There is this anti-intellectual bent too, and you don't like being shown, shown that you don't know something. But I think that we use words really sloppily in this regard, and I think that's lent itself to misinterpreting the weight and the proper use, the place to file away scientific knowledge. I don't think people use theory meaning one thing to a scientist and something else to people walking down the street.
Yeah, totally.
And the fact that it's something that changes and you can always revisit and change it. So then why should I accept anything as black and white? It's a subtle way of thinking that I think might be beyond most people.
So teaching critical thought might be important in school.
Yeah.
And, how science works and that science does change over time. And then, all the different kinds of ways that science can evaluate a particular problem. And sometimes you end up like this study that was came from Health and Human Services. What they were actually saying wasn't the conclusion that people ran away with.
Right.
And just be willing to read it. Like even my eyes glaze over sometimes, and I'm like, really? I have to, how many pages is it?
I gotta start
54?
again.
I'm going to lose my mind.
Yeah.
But and people hate on science constantly. This is a pet peeve of mine, actually, is people talk about art and music, and that's important to our culture. But you know how many art museums I've gotten dragged through, because I'm on a school field trip, or my ex-husband, who was an artist, found it to be important, and I was trying to be supportive. Nobody will go with me to a science fair.
Really? Wow.
And why can't we see science as valuable? And you could probably even extend that to technology. Why? I look occasionally at a chart note on a very sick, complicated patient, and I like dab tears out of my eyes because to me, it's as beautiful as anything the great masters made.
What
And,
is?
Like
what
a chart
is?
note, like the way somebody was taken care of in the hospital, and how thought went from kind of medical crisis to stabilize this, stabilize that, consider this, consider that, look at this, look at that, and to somebody being discharged from the hospital in a much more healthy state, much more. When people come out of the hospital, for the most part, they're usually like running at as peak efficiency as they can, and then it kind of slowly degrades over time. but the charting of that, when you get somebody who is educated and putting thought into it and really trying to be thorough, is just as beautiful as the Mona Lisa to me.
Wow.
Or
Wow.
looking at Yosemite to me. It's captivating,
Oh, man, that's
and I just
beautiful.
gaze at it and I'm like a weirdo in that. You're looking at me like,
No, I totally understand that. I can completely get that. Sure. Sure.
And then when people are saying, "Oh, science gets all the support and art gets nothing," I rarely see anybody gushing on science
Right.
and happy that this money is going to this scientific study.
Yeah.
And people just mostly remember they hated their chemistry teacher in high school, and that's like where they dropped out
Right.
of love with it. So
Well, the way that science is being weaponized, or at least the attitudes about science are being weaponized, and things are being so rapidly defunded by the federal government, of no scientific basis, all this philosophy,
and the
other
flow
stuff.
of credible information is quashed.
Yeah.
As a provider, I used to get all these emails. I used to be notified by this kind of stuff, and now I get emails from a different source. Usually the American Medical Association is now kind of like being
Trying to step into that vacuum. Yeah.
trying to be the voice in the darkness.
Wow. Wow.
Yeah. And and we have our ways, and people have kind of stored scientific information that got dumped off different websites by the federal government. So it's years, decades, maybe even 100 years of research isn't lost.
Wow.
Yeah. So it's a great dark age.
And apropos of all of that, and this weekend here in Del Norte County on the Northern California coast, we had the school district had a science fair. It was at the fairgrounds.
Awesome.
And Redwood Voice went to it, so Redwood Voice Youth Media will be producing a story about the science fair. Keep an eye out for that at redwoodvoice.org. But yeah, people still do care about science out there and getting kids involved. It's just...
And they dig it, and they come up with really interesting ideas to. It's not all the baking soda and vinegar volcanoes.
That's all.
My daughter won the science fair, and I think she was in 4th grade, and she did paper chromatography of Skittles. So she broke down the color spectrum in Skittles.
Oh, wow. Oh,
I
wow, that's
know.
fun.
I don't think she clearly understood it, but definitely I was digging on it.
That's really cool.
For better or worse.
My eldest is getting a PhD unless her program has been defunded, which is a possibility, where she is up at the University of Washington because they get federal funding from NIH or something about studying it's eating disorder sorts of things that they're studying, or she was studying, the neurological underpinnings of that. It involves lots of mice. So, but she did this thing. She would do these things when she was in school. Odyssey of the Mind.
Yeah.
You know that? You remember that from your kids? It's like, these kind of, the gate kids get invited, to come and to do something, and they go away for a weekend, and they're putting together pipe cleaner projects and doing all of these things and as a team, and going, we need to figure this out. Let's invent this tabletop mechanism that will do it. She told me, this was so funny, one of the last times when I talked to her, that like, going off to graduate school and getting a PhD, That's exactly what it's like. She said all that Odyssey of Mind stuff, all those weekends, all those group projects and everything. She and a fellow scientist in her lab, another student in her lab, I guess, had to come up. We've got a test for this. We've got here's what we're looking to find out. So what have we got here in the drawer? What can we put together to make this? And she said it's exactly what science is like. So if your kid is involved in any of those sorts of like programs, know that you're fostering something that could really be a benefit to them in the future like that. I had no idea. So right on.
I know
public
you never
education.
know when you're actually doing it right as a parent, but you hear a lot about when you're doing it wrong.
I was just the drive too. I was the ride to things like that. But a lot of the teachers here and across the region who put in all this time are really helping kids with applicable skills. And I thought it was just critical thinking. Oh, maybe abstractly this will be. Nope.
Right.
Nope. Here's a goal. Let's build something to get to that and put our heads together scientifically.
Just a plug for CR. High school students with certain grade average and interest can take CR classes for free. They're not really told about that. And they're both positioned so close to each other they could just walk across the parking lot.
University of the parking lot, exactly.
Yeah, great classes at CR for high school students to start kind of completing Gen Ed, or if they're just bored and they want something, they want to reach a little.
And do you know, is that like credit that sticks with them though?
Yeah, it is.
Okay,
and
cool.
it saves money
right.
later down the road. The other thing is I was a Sputnik kid. That's why I'm all science all the time.
Is that what it is? Really? Really? Was that a big formative thing?
Yeah, I was in kindergarten in '63, I think.
Oh, wow.
And I remember thinking that art was like
really, it's
boring.
Not cool. That's not cool.
Yeah, and my parents
For
did the
long
same
hairs?
thing. They made opportunities available, and I remember being heartbroken when I ran out of science classes at my high school.
Oh,
so
really?
I started taking college ornithology when I was a junior.
Oh my God, you ran through all the science.
Thank you for parents that make that happen. That's super important.
Wow.
Yeah.
All right. Well, what do we have happening for next week then?
I'm talking on two things. One is the medical technologist who works at UHS has agreed to come talk to us.
Okay.
And so she's in the near future. But I thought, and this is a perfect segue, I'd talk about IQ.
Ooh. Oh, wow. I've got lots of questions.
What does it really mean? And why do people get, people get labeled early?
Still?
I think so.
Okay.
And
because in my mind, like just the anecdotal sort of the things that pop up when somebody brings up IQ, I think, okay, well, that's got a lot of biases involved. It's like, even things like your body, your BMI, which has like racial overtones to it and things like that too. So I've kind of discounted it in my mind, but it's still, they're saying, oh, you're this number, kid. This is what's going to happen to you.
Yeah. And what does that really mean for somebody's life? Which I think is nothing really. Yeah. I mean, the person has free will, but we'll talk about that next week.
Oh, then we can get into free will.
Yeah. Oh no.
All right, Lynn. Well, thank you very much. You've been listening to Health Matters, and I'll see you next week, Lynn.